Hi everyone. Today I would like to introduce a procedure which is done clinically in a patient to save the tooth. In this image you can see a normal healthy tooth which looks outer surface like this but have different structures which looks within. So outside you can see enamel and dentin, but within the tooth you can see many nerve fibers and blood vessels which includes as a pulp, and also you can see the gingiva and the bone. So this is how a normal healthy tooth looks like. But if the same tooth is infected by means of caries or presence of plaque, you can see this is black color one is the infection, that is nothing but caries, which is spreading from the external surface to the internal. So from the enamel and dentin, it's spreading inside the tooth and infected the pulp. You can notice the changes within the pulp. So this leads to the infection near the tips of the root. So what can we do? A normal tooth is completely different from the infected tooth. So how we can save the tooth? There is no need to remove the tooth if the caries spreads within the tooth. We can save the tooth by help of a root canal procedure. So you can see this, the infected red color pulp is removed and it is filled by an intact filling material that can save the tooth in the arch of the oral cavity. That's how the tooth will stay within the oral cavity back in its position. This procedure includes 3 steps. First one, axis opening will enter within the tooth from the outer surface with the help of the instruments. And second step, this is how the first axis cavity looks like. This is the opening and entry point for us to enter into the canals, that is root canals. And the second step include, this is the infected pulp and these are our instruments to remove the infected pulp from the tooth within the root canals. And third step include filling of the space which is remained after removing the pulp. And this how we will fill the canals with the help of gutta-percha points, which is the root canal filling material, and also with the help of root canal sealer. So this is the picture which is showing the intact and compact filling. You can see the pink color one which is filling the root canals which were earlier filled with the nerve fibers and blood vessels in the form of the pulp. So in the space of the pulp, this filling material will be going to stay in the root canals. So this is sealing this root from the bottom as well as from the top. And this procedure will help the tooth to stay in the arch. If you see, the height or the form and the structure of the tooth is similar to the adjacent teeth, but only thing is it is filled from within. So the roots are filled to make the tooth more stronger, so that the tooth remains in the arch and help us to chew the food, to speak, and also if it is anterior tooth, it also helps us to enhance our smile. This how the root canal procedure will save the tooth and will help the tooth to remain in the arch to maintain its functions and form. Thank you for listening.